My name is Pujols McKee. I am Executive Vice President and Chief Medical Officer of the Joint Commission. I am also their Chief Diversity, Equity, and Inclusion Officer. I grew up in the South Bronx. My parents had come to the South Bronx from Puerto Rico in the early 50s. I got very little support to advance my academic career in high school. I took action and I found a program called the Connecticut College Post-Baccalaureate Program for pre-medical students. And I was able to get that scholarship. And I became a medical resident in internal medicine at Presbyterian Hospital. It was then affiliated with the University of Pennsylvania. Patients of color were discharged and followed at a medical clinic that was run by residents. And I turned my attention to that medical clinic because I knew that was the primary source of care at that community, which gave me an opportunity to do many things, one of which was to be able to give guidance and direction to other doctors and nurses. I knew somehow, innately, that that was something I was going to need to know how to do. A couple of years into that role, I got tapped to become the medical director for the Philadelphia Public Health Department's Family Medical Care Services. And that was a very rewarding experience in helping raise the level of service, the quality of service, by providing the physician community and the nurses with education so that they can maintain their skills. At some point, I really had to make a decision, and I had to leave the health department, but there was an instinctive part of me that said, the more I understand the different aspects of healthcare, the better leader I will become. And so I've worked inside Independence Blue Cross. I've worked inside the public health department. I've worked inside correction facilities, nursing homes, ambulatory facilities, acute care facilities. By the time I became a leader at Presbyterian, all of that entire spectrum of knowledge, of understanding the healthcare spectrum, was really what I think helped me become the first chief medical officer at Penn Presbyterian. While I was serving as chair, and shortly after, I was tapped by a search company, and I initially thought it was kind of comical to leave Philadelphia and go somewhere else to work. And as I interviewed and met the people at the Joint Commission, I was super impressed at their expertise, their level of sophistication and commitment, passion towards improving safety and quality. And it became quite an attraction for me. I've been there now 11 years. It has been an extraordinary experience. I'm very proud of our accomplishments. The work that we do continues to be extremely important, and there's still much work to be done.